and gentlemen, welcome all for this panel discussion about implementing the International Code of Breast Milk Substitute in countries, time to accelerate action, and the presentation, the launch of a report. Today's panel will be moderated by Robin Gorna, who is the Executive Director for Partnership for Maternal and Newborn Child Health. Before giving the floor to Mrs. Gorna, I will ask you to receive all a little present from the Geneva Press Club. So there are the drawings for peace, the exhibition, which is right now near Geneva. And I will ask you as well to sign our gold book. Our blue book. Oh, yeah. And Mrs. Gorna, you have the floor.
Well, thank you so very much to the Geneva Press Club for so warmly welcoming us this evening. And it's really quite a historic event. I want to recognize the members of the missions to the United Nations based here in Geneva, many colleagues and friends from WHO, the international agencies, NGOs, and a very young and very welcome member of the audience too. It's good to have breastfeeding in practice when we're here to discuss breastfeeding. This is such an important gathering, and I really thank you all for making time in your very busy schedules to be here. It's an absolutely historic moment for this group, and as you heard, I have the privilege of leading the Secretariat of the Partnership for Maternal, Newborn and Child Health, so you don't need to convince me that partnerships matter. Partnerships are absolutely vital to how we work together. It's the opportunity for us to bring the very best of our different perspectives together, and in this critical area of breastfeeding and supporting the code, there have been many actors over a very long time, and this is the first time that UNICEF, WHO and IBFAN have worked together. They've published this report today, and I think it's a remarkable document, both in terms of the content within it and the fact of collaboration between these three agencies. So I congratulate very much everyone who's been a part of pulling this together, and I thank you for all of the hard work and diligence. Bringing together different agencies with different perspectives is never straightforward, but it enriches what we do. And so I'm very excited to hear the detail of what's in there. What we're going to be focusing on today is that relationship between legislation and rates of breastfeeding, and how protecting the code and promoting the code will enable us to achieve the public health goals we have of promoting breastfeeding. I think the other really important thing about this report today is the stress on accountability. Whilst we are seeing in this report about the numbers of countries that are implementing the code, in part or in whole, what it also reports on is the number of countries that have got effective monitoring mechanisms. And I think that what we know very well is that making promises is one thing, keeping your promises is the other thing. And to make sure that we know if people are keeping their promises, we have to be rigorous and energetic in our efforts to secure accountability and to make sure that we monitor to be sure that what we say we will do gets done. So I think this is a really important document. I'm very much looking forward to hearing from all of the colleagues here on the panel. What we're going to do now is listen to 5 presentations from the 5 colleagues up here. I'm going to give them all between 5, 10 and 15 minutes to speak. I'm going to keep you rigorously to time if I can. Then we'll have a discussion, and following the discussion we will have a few more refreshments, and then we have the opportunity to see this fantastic movie Tigers. I've heard a great deal about it, and I'm really excited that we get to watch that tonight to really see in a more dynamic way some of the implications of what we're here to talk about. On the panel tonight, we have Dr. Nigel Rollins, who is a scientist in the Maternal, Newborn and Child and Adolescent Health Department in WHO. I had the great pleasure of meeting Nigel when I worked for UK Department for International Development. We met on a beach in Durban, and some fantastic research on breastfeeding seemed to eventuate from that, and I always love to hear his findings on breastfeeding, even if it's not on a beach in Durban. Then we will hear from Dr. Laurence Grummer-Strawn, who is the Technical Officer in the Nutrition for Health and Development Department in WHO, and he's going to walk you through an understanding of what's here in this fantastic report on the national implementation of the code. Then Dr. Francesco Branca, the Director of Nutrition for Healthy Development at WHO, will introduce the Netcode, and he'll also talk a bit about the WHA resolutions, and I think many of those of you from the missions will be more than aware that a resolution is forthcoming later this month. Then we will turn to Marilena Viviani, who is the Director of the Geneva office of UNICEF, to talk about human rights, the International Code and the SDGs. And finally, we'll hear from Mike Brady, Campaigns and Networking Coordinator at the Baby Milk Action IBFAN network, about the importance of independent on-the-ground monitoring and effective enforcement, so really stressing those accountability points. So without taking any more of your time, I'd like to turn to Nigel and invite you, please, to talk us through the new evidence on the benefits of breastfeeding, please.
Someone bring up the slides?
Which one is it?
This one, yeah.
Okay.
Yeah.
And just like
Thank you. So first of all, Robin, thank you very much for the kind comments and for the invitation to share today. I'm going to race through some slides. You'll have the slides available to you at any stage. But I'm going to share some data from 2 papers that were the work of about 30 authors that was published in January. And it asked the question, what's the relevance of breastfeeding to women and children in low, middle and high income countries in the 21st century? Not just to the sort of pigeonholing breastfeeding as something for low resource settings, for poor women, to stop child mortality, but across the board, what is the relevance today? And there were 2 papers that examined this question. So one of the first things that came out of it was probably the first global map of breastfeeding prevalence. And not surprisingly, we see the highest breastfeeding rates in sub-Saharan Africa and also in South and Eastern Asia. And that's maybe not a major surprise. One of the big problems that we actually came across was that in many high-income countries, there simply wasn't data. That the value put on breastfeeding is such that we don't get good data from the high-income countries, much better data from other settings. And when we looked at the trends over the past 20 years, we see that exclusive breastfeeding rates have increased marginally, up to about 36–37%, but that the continued breastfeeding rates, anywhere between 60 and 80%, have pretty well remained static over that 20-year period. When we looked and sort of ran some models, we see that breastfeeding still has a massive impact on child mortality. About 820,000 children under the 5 years of age would be saved each year if breastfeeding rates increased from where they are now up to what would be around about 90% breastfeeding rates. It's a staggering number in this day and age, and the vast majority of those deaths would be amongst children less than 6 months of age. When we looked at all the evidence, and these come from, and there are a number of copies of this supplement in Acta Pediatrica that are available outside, and you can take those if you run out of copies, see me. We looked at all the evidence reported in the literature over the past 15–20 years, and we summarized those effects. The things that it has an effect against: acute otitis media, which affects many children, even in Geneva. It has an impact on type 2 diabetes, obesity. It doesn't have an effect on asthma, eczema, food allergies. But longer breastfeeding is associated with higher performance on intelligence tests, about 3 IQ points. And this is of relevance in low, middle and high income settings. And when you translate those 3 IQ points into salary when you are 30 or 35 years of age, and when you take the current breastfeeding rates and you say what it could be, then this translates into an economic loss of about $300 billion per year. $300 billion per year. It far outweighs anything to do with the health savings. We wouldn't want to equate that with mortality because you cannot put a cost against a child's life. But for middle income, for the aspiring parents in middle and low income settings, this is a big deal. But the benefits aren't restricted to children. We also looked at the literature on what it does for mothers. And it increases or decreases invasive breast cancer by 6%. It would translate into 20,000 deaths being saved amongst women each year. And it raised the question, are these effects biologically plausible? And we see that breast milk is absolutely unique. It has oligosaccharides in it that train and interact with the gut. We see that it changes completely the microbiome, which is that alters the whole immune programming of individuals for life. We see that it has a source of stem cells. We don't honestly know what all of these do, but stem cells can go and they migrate into organs across the body. It is just utterly different from anything that you can substitute through any industrial process. And yet, despite all of this evidence, we see that women are not gaining the support that they need to breastfeed. And we ask the question, why? And we're talking today about the code. The value of the baby milk formula globally is about $44 billion per year. $44 billion. And by 2019, this is going to reach up to about $70 billion. And in developed countries like Geneva, Switzerland, France, the UK, the majority of this is in products for children over 6 months of age. So we have a whole list of things to do that we know will work. It is not a matter of waiting a generation. Breastfeeding practices can be changed within a 3 to 5 year period. And it is not just a matter of divesting the responsibility to government, and responsibility is for each of us to create a supportive environment for mothers to exercise that choice. Keith Hansen, who's the Vice President for Human Development in the World Bank, said, if breastfeeding did not already exist, someone who invented it today would deserve a dual Nobel Prize in medicine and economics. Another colleague who was part of the authorship team said, if you put all the scientists in NASA and all the money, you could never manufacture anything like breast milk. Thank you very much indeed.
Thank you, Nigel, and perfectly to time. I'm going to hand over now to Dr. Grummer-Strawn, who's going to tell us all about the marketing of breast milk substitutes. I think that's an extraordinarily helpful backdrop to remind us as to why what we're doing here is so important and why this matters so much in the national implementation of the code.
Well, thank you, Robin. And thank you to Nigel for setting an important stage for the importance of tonight's topic. So we already have the background. I hope you're all convinced by Nigel's research there on the importance of breastfeeding. We're going to focus on one aspect of that call to action that he ended with about the implementation of the Code of Marketing of Breast Milk Substitutes. So this is our context for the evening. We're not going to go through tonight all of the details of this code that was passed in 1981 by the World Health Assembly, but just so that you have a context here, that code has two major aims. Primarily, it is to protect and promote breastfeeding, but it also has the aim of ensuring the proper use of breast milk substitutes when they are needed. This is not anti-formula, it is not anti-breast milk substitutes, but it is a code about how marketing ought to be happening for the optimal health of our babies and mothers. The code covers a number of different topics. It covers the content of informational educational materials as to what they should include and what they shouldn't include. It talks about the advertising of these products within the scope of the code and basically says they should not be advertised to the general public. It talks about samples and gifts that they should not be given to mothers or to healthcare providers. It talks about the role of healthcare systems and workers and the responsibilities that they have. We're going to be talking tonight about the role of countries and the legislation that is needed. But the code does not only apply to countries, it also applies to healthcare providers, and it lays out what are the responsibilities that they have. It lays out the role of manufacturers and distributors and what they are responsible for in implementing the code and protecting the lives of mothers and babies. And finally, it has rules about what can be on product labels for these products. So I said we're going to focus on the role of countries tonight. And the document itself lays out a number of roles that we expect countries to do. The two primary ones there are to translate this set of rules about how marketing of breast milk substitutes ought to be done into national legislation and regulations. And secondly, that they should monitor compliance with that code and ensure that it is enforced. And so the report that we're reporting tonight and releasing tonight really takes these two contexts. First, about what is the status of the legislation itself, and secondly, what is the status of monitoring of that legislation where it does exist. So in terms of our methodology, we evaluated whatever national legal measures exist in all 194 members of the World Health Assembly. We obtained copies of national legal measures, whether those be laws or regulations. And we used a number of different databases for that. We started with WHO's own global database on the implementation of nutrition action. We sent out a survey to all member states in 2014 to answer questions about their legislation and send copies of it to us. We also used a 2015 survey by WHO on non-communicable diseases and collected legislation through that mechanism. We used internet searches and searches of particular databases to find this legislation. And we also used what IBFAN had available in its repository in the various technical assistance that it has provided to countries over time. So we aggregated together a number of sources to have a nearly complete database of the national legislation that exists for every country around the world. We then looked at each of these legislations provision by provision and matched it up against the code. So we had a long list of what does the code cover, and we said, how does the national legislation stack up against that for each country? And then we took that and brought it together as a conglomerate across WHO, UNICEF, and IBFAN to agree on a categorization of that law. Does it cover most of the provisions, just some of the provisions, or very few of the provisions? So let me transition now for the other part of the methodology. It was about the monitoring itself. So we sent a survey to all countries about how they are currently implementing monitoring of the legislation that they have on the books. And that survey went to all member states. We had responses from 55 countries, so I'll be reporting on the responses from those 55. So moving on to results now. In terms of overall categorization of the legislation, the good news is that we have an increase in the number of countries that have implemented legislation in line with the code. When we did this study in 2011, we found only 103 countries around the globe had passed any measure at all in line with the code. And we've seen substantial progress in these 5 years. It is now up to 135 countries. However, that masks that we're not seeing much of a progress in terms of the number of countries that are fully implementing this code. Most countries only have a few of the provisions of the code actually put into their legislation. And when we look at comprehensive legislation, it's been essentially flat. We now have 39 out of 194 countries around the world that have taken this code that was passed in 1981 and put it into their national legislation in full. So a good news story that we are making progress, but a bad news story is we have a very long ways to go in terms of comprehensive implementation. How does that look around the globe? Here's a map showing the status of each country around the globe. And I think what you might see here is a striking similarity in terms of the colors of this map and the colors of the map that Nigel put up. The countries with the weakest legislation, the United States, European Union countries, Australia, those are the places where breastfeeding rates are the lowest. And when we look to Latin America, Southern Africa, and South Asia, those are the places that we have the strongest legislation in place. So what are the provisions that are being covered? I'm not going to go into all of the details here. The details are in your report over a number of different pages, but some of the key messages that come out of this. about a third of countries, a little over a third of countries that have any legislation at all, cover products after the age of 1 year of age. The WHO recommends that breastfeeding continue for 2 years or longer. So there's a mismatch here in what products we're covering versus our recommendations on what is optimal feeding. We look at the prohibition of advertising, and only about half of countries actually prohibit the advertising of these products, a critical component of the code if we're going to protect breastfeeding. How many have prohibition of samples and gifts? Again, just over half of the countries have legislation on this aspect of the code. And so we have a long ways to go in terms of putting these provisions into place. When we look at the status of monitoring, as I said, we got responses from 55 countries, and a little over half of those countries said that they do in fact have a monitoring system for the implementation or the monitoring of the code in their countries according to their legislation. However, when we start asking questions about how that system is actually functioning, we find they really are not functioning systems. Only 6 of the 55 countries said that they had a regular budget or funding to conduct that monitoring on a regular basis. Only 7 of them had published their findings from the last time that they had done any monitoring. And about half of those countries that had any systems at all had used it for imposing any kind of sanctions. And very few of them monitor those on an annual basis. So there's not much out there in terms of monitoring, and when it is even on the books that it is happening, it's not very comprehensive. So what are our key challenges for this implementation? Clearly a key issue is the lack of political will. We see interference from manufacturers and distributors when we're trying to create legislation, and certainly when we're trying to implement it, many barriers to actually see that it is in fact enforced. There's often not sufficient data or expertise to help countries to create good legislation or to build strong monitoring systems. And there's an absence of coordination among the actors. The Netcode that Francesco is not going to be talking about next tries to address these barriers in terms of providing that kind of assistance to countries, both in how to do monitoring and then coordinating the partners on the ground. So we end the report with a number of key recommendations that I'm happy to have you read. Just to summarize them here, the key issue is that for those countries that have no legislation in place, they need to enact this code legislation. We should, at this point, 35 years later, be seeing all countries around the globe having legislation in place about this recommendation from the World Health Assembly 35 years ago. Secondly, and maybe even more importantly, those countries that have enacted the code need to go back and look at their legislation more carefully and see what are the areas of the code that it is not putting in place. The majority are not, in fact, comprehensive. And they need to build functional monitoring systems to ensure that the code is not just a piece of paper on the books, but in fact is put in place and is in fact enforced and adhered to. UN organizations, NGOs, academia need to support countries with both the implementation and the monitoring of this code. I want to thank you for your attention tonight, and I look forward to discussion with you later this evening.
Wonderful. And now we'll hand over to Dr. Francesco Branca. As we heard from Laurence, there were 2 key aspects to this report, the translation of the code into practice and the monitoring of it. So I think it's really exciting to hear about the introduction of Netcode, which, as you can see, is the Network for Global Monitoring and Support for Implementation of the International Code of Marketing of Breast Milk Substitutes and I think that's where it ends, yeah? I'm really glad you called it Netcode, Francesco.
Thank you very much, Robin, for being here, and thank you, all of you. Yes, Netcode is something we felt was necessary because of the insufficient work that is done to monitoring the implementation of the code. So we felt we need to join forces. And you've heard that the monitoring mechanisms that are in place are also linked to the somehow partial legislation that countries have put in place. So we said, well, it has to be related to the code, also to the subsequent resolutions, because somehow the subsequent resolutions, there have been 19 since the approval of the code, have provided an update and a better context The world has been changing in these 35 years, so we need to be up to date. So what we would like to see with Netcode, we would really like to see a world in which all sectors of society are protected from the inappropriate and unethical marketing of breast milk substitutes and other products covered by the scope of the International Code and other relevant resolution. And the goals are really two. One is to strengthen the capacities. I mean, the code is owned by the countries, so we need to make sure that they have the capacities to do this monitoring. And then to facilitate the development of legislation. So this is not just to give marks or to evaluate the situation, but it's actually to push the political agenda further. And you see the group that has put together Netcode, those who have been working in this 35 years in this area, but with a lot of connections, by the way. I mean, it's not that we've been working in silence, but I think, you know, we've not been able to really connect our world in an efficient way. And you see, together with the two UN, UNICEF and World Health Organization, a group of civil society organizations, Save the Children, WABA, Helen Keller International, IBFAN, as well as other groups who have been supporting this effort, either from the academia, I mean the Metropole College, or donors. And the donor here is the Bill and Melinda Gates Foundation. What we would like to see with Netcode, we would like, first of all, to make sure that we have a common monitoring protocol, that we all are in agreement on what needs to be monitored and how. We then want to build the capacities. We want to have some first products. We want to see more data. We want to see the future reports with more countries in. And we also want to have a voice, a common voice for global monitoring, enforcement, and advocacy. I'll just show you quickly what the idea is of the monitoring framework. Well, first of all, the scope. This is not only about breast milk substitutes in the first 6 months of life, but it's also about follow-up formula, growing up milks, and, you know, in general, different types of milks which do displace breastfeeding at different ages. Other food or liquid targeted for children, commercial complementary food, you are seeing an incredible surge in the marketing of these products, particularly in the medium-income countries. This is when the food environment starts to be poisoned, and that's also what is conducive to a later risk of obesity and chronic diseases. So there's two components. There's an ongoing reporting of violations of national law and the code for the purpose of taking corrective actions. The countries would like to have real data to act on these violations, but also would like to have some tools in our hands to actually hold the companies accountable. And sometimes they say, well, we have a good self-regulatory code. Well, we actually would like to provide the evidence that that self-regulation is not effective. And then the second component is periodic in-depth surveys to identify problem areas that will then warrant some policy development. So the ongoing reporting is based on multiple government mechanisms, but also on public reporting. We have some countries like the Philippines who have done extremely well in mobilizing the whole civil society in reporting these violations. And the second component is more of a situation assessment where we're actually going to use scientific methods, and particularly sample surveys of mothers, as well as observation and interviews with healthcare providers, and observation in retail outlets, as well as media monitoring studies. I won't give you the details of the methodology, but it's about a certain number of mothers, a certain number of clinics, a certain number of health care providers that are going to be involved, so that we're actually able to quantify the amount of pressure that this marketing strategies put on people. These other countries have, are the early risers of this initiative. So we have 3 that are actually performing monitoring now, but we have probably by the end of the year 7, and we would like to see this group increasing. The Netcode will work on technical guidance on enforcement mechanism, on legislation, will hopefully harmonize reporting, will deal with conflict of interest, and develop, adapt, and disseminate training materials for health workers. So we're just at the start. We've been working for the last year or so, but will be successful for the health of the children. Thank you.
Beautiful, Francesco. Thank you so much. So now it's my pleasure to introduce Marilena Viviani. She is the director of the Geneva Liaison Office, which is in the Public Partnership Division of UNICEF. Marilena, it's lovely to have you here, and we look forward to hearing about the International Code on Human Rights and the SDGs.
Thank you, Robin. And first of all, I would like to thank all colleagues for being here today. It is really an historic day, it's an historic event. And I'm here also to represent a dear colleague, David Clark, who is not with us physically, couldn't come. He's been one of the contributors to the report. I don't know if he's connected through the webcast. I hope he does, but he's with us, and he's sending best wishes to everyone. I think today we heard, and we saw it in the report, the importance of the code and the critical importance it carries, not only in terms of children's survival and health and well-being and development, and we saw the impact of breastfeeding on the education, also attainments and economic growth with the contribution to the IQ up to 4 points. But what I wanted to stress today, and maybe to complement the presentation of my colleagues from a different perspective, is to look at the context in which we need to also make efforts for the legislations to be able to fulfill this important goal for the breast milk substitute. So this is why I thought that with this opportunity we could highlight some other components of the discussion, and the first one is on the SDGs, and then I will go a bit more maybe on the human rights and the children's rights. I think there is no disagreement that children's rights are a key component of human rights, but at UNICEF we have to stress it all the time. So we will speak about that and to see how much this is relevant also for the discussions we are having today. And I will start with the SDGs. We heard also that the Lancet breastfeeding series has stressed and underscores the importance of breastfeeding as a fundamental driver in achieving the SDGs. These are the Sustainable Development Goals, a very ambitious agenda approved by all countries in the world last September. So the context is there, and there are, maybe the point I want to make, that there are no excuses for any countries not to implement the code, even though we saw the data that the situation is improving, but we see that much more needs to be done. So all the countries have signed up to fulfill the SDGs, and breastfeeding is a key component for that. And we heard already that is one of the smartest investments that countries can make to ensure a healthy, equitable, and sustainable future, which is one of the objectives of the SDGs. And it has benefits not only for individuals, but also for their families. We also the impact of breastfeeding on mothers, to end preventable child death. And we heard the figures, 820,000 deaths prevented per year could be prevented through breastfeeding, and improving health, education attainment, and productivity. And we heard about the figures on the economic growth. Stronger breastfeeding policies and programs are essential to driving progress in reproductive, maternal, newborn, child, and adolescent health, and they directly support the achievement of the SDGs. So we heard the recommendations for action from the report, and one of the important maybe element that I can add to complement is that the SDG number 17 is about a new partnership, a new global partnership. And Robin has spoken of partnerships, is here to represent partnership, but this is not a new partnership to sign up. It's all of us here to commit to the SDGs, and we do it today by contributing to the code. But in terms of the component of the human rights, and I would like to be more specific to the children's rights, and I think it goes beyond any question that for UNICEF this is our raison d'etre, I want to stress that when a country has ratified the CRC, the Convention of the Right of the Child, it means that governments must take all appropriate measures to realize the rights articulated in the Convention. And the protection, promotion, and support for breastfeeding are essential components of the child's rights to life, survival, and development, to health and healthcare, and implies legal obligations of countries. When we speak of human rights, we have the right holders and we have the duty bearers. And in specific, the Article 24 of the Convention of the Rights of the Child requires countries to ensure that all segments of the society, in particular parents and children, are informed of the advantages of breastfeeding. And there are other articles that will also refer to that. But it's not the only human rights mechanism. There are the others that also have explicitly referred to the obligations of countries under relevant international human rights treaties to implement the code and other relevant World Health Assembly resolutions. And we have also a specific PowerPoint on this, if there is time and interest later on, just specific on all the articles, the conventions, and the tools that could be used, thanks to my colleague at WHO, Marcus, who have prepared it, if there is interest. So I just want to say, if you want to support children's rights, you can do it also by supporting the code. The report that is being launched today is a critical component, and we, as UNICEF, we look forward to continuing our work with WHO and IBFAN and with all of you to fulfill these important components of the child rights into the agenda. Thank you.
Thank you very much, Marilena. And I know there's many questions brewing, and we will shortly be turning over to the audience for questions. But before we do so, it's my great pleasure to introduce Mike Brady, the Campaigns and Networking Coordinator for Baby Milk Action, IBFAN, to talk to us a bit more about the importance of independent on-the-ground monitoring and effective enforcement. Mike, the floor is yours.
Thank you very much. I'm very pleased to be here. The International Baby Food Action Network's actually been monitoring companies since before the International Code was even adopted in 1981. We were at the 1979 meeting called by UNICEF and WHO, which began that drafting process. There were 6 groups at that stage. Today there's over 270 in more than 160 countries monitoring what the companies are doing on the ground. The legal officer from our International Code Documentation Centre in Malaysia took the lead for IBFAN in working on this combined report. And her name, Young Joo Keen, sends her greetings and her apologies that she cannot be here in person today. I have been with Baby Milk Action for 20 years and worked closely with the IBFAN network and ICDC. I first met ICDC actually at a training course in 1997 in Almaty, Kazakhstan, which was organised by UNICEF to train policymakers on the importance of the International Code and resolutions and how to implement these measures in legislation. And it's training events like these and thorough follow-up afterwards that have led over the past 30 years to the laws that we have in place today in more than 70 countries that have fully implemented the code and resolutions, or most of the provisions. There are other countries that are still in the drafting process, and we will be seeing this number increase. You'll see in the case study report, you'll see in the report there's a case study about Armenia, and I met people from Armenia at that training course. At that time, the country had been basically invaded by the formula companies following the fall of the Soviet Union, and also following the earthquake in 1988, which opened the country to donations of formula, which was a way to try and bring those brands into the country. IBFAN made contact with health advocates early on, exposing these practices and shaming companies into stopping the worst of them. For example, we stopped formula advertising on television and so on. But the long-term solution has to be legislation. And those Armenian representatives went away and drafted the first legislation that has been progressively strengthened. ICDC monitors the state of implementation since 1986, producing state of the code charts, and this latest version for 2016 was used in the development of this report and is in line with these, although we go into some more detail in some areas. And we're very happy to have this cooperation with WHO and UNICEF in producing these, this assessment of the laws. So progress is being made in introducing legislation, but as the report shows, there is still a long way to go. And this is because industry opposes legislation every step of the way. You'll see the Philippines is a case that has provisions in law in the report, but in 2006, when it introduced stronger legislation, it was taken to the Supreme Court by the pharmaceutical industry, and they had the legislation suspended. In the end, the Supreme Court ruled that it's not unconstitutional to restrict trade for the public good, and threw out the industry challenge. So this is the sort of thing that we're up against with the companies using legal threats and the argument of trade and employment and so on. We monitor what they're actually doing on the ground to expose them and show that there needs to be regulations. And we produce monitoring reports periodically with examples of the sorts of practices that they're really doing. And we have some examples here that we can perhaps show you during the discussion. Thank you.
Well, thank you to all of our panellists. What a very rich series of presentations that was, taking us through from the evidence through to what we know about the implementation of the code and the status of monitoring, the new approaches to monitoring, and of course human rights, as well as some excellent examples of what's been happening in a range of countries. So the floor is now open to the audience. I'm not sure whether we can take questions from those of you watching on the web stream, but we would certainly be, we can. Oh, how exciting. I don't quite know how that's going to happen, but let's start with people here in Geneva. Do we have any questions or comments from the floor? None at all. Oh, I see one little twitch of a... No, someone's just waving at someone else in the room. Patty, do you have a question?
Well, I shouldn't really speak.
Oh, come on. Put your mic on, I think.
No, I think it was really good. Oh, yeah, sorry. Microphone, I'm Patty. I work with Mike in Baby Milk Action, and I just wanted to say, as we did this afternoon, how important this is, this having WHO, UNICEF and IBFAN working together on a report, and we're baffled about why we haven't done it before. I've got lots of theories, but it is really important. And one of the journalists this afternoon came up with that whole thing about the trade aspects, which we haven't really touched on yet, and how difficult it is. We're entering a period now when countries are being chilled. They really are frightened of being able to go ahead and do the legislation. And so for us to have WHO and UNICEF right behind us here, maybe not seeing eye to eye on absolutely everything, but on the main things. I'm looking at you, Larry. But, you know, we're together, and that's fantastic because it's really going to be needed. I do a lot of work with Codex, and it's really hard now. The trade issues are really pushing forward ahead of health. And as people have asked about EU and all that sort of thing, it's really hard because the industry are coming in and saying what we need is better, more products with more nutrients and more this and that. And so innovation is taking over from a very basic thing, breastfeeding and family foods. So I'm putting the whole together now. For us, it's not just breastfeeding, it's how that mother and baby dyad work for the whole of the 3 years. And so it's that question of how, what are you going to give us and help us in these trade battles, really, because that is what's on the agenda now for the World Health Assembly coming up. And I think it's a question, and it's also a statement, I suppose, but it is something that needs to be answered, I think.
Thank you, So one question, how are we going to deal with the trade battles? Do we have a question online? No? Do you have any other questions? And Mesfin, please introduce.
Yeah, just mine, Mesfin Taklu from World Vision. Just a couple of comments and question maybe. I think it's great, I think we upload, the report and, the partners that have worked together to get this report, and also the progress since 2011, number of countries that have shown some sort of legislation. But still a long way to go in terms of enforcement, monitoring, and ensuring that everything that is marketed as breast milk substitute is included in the code. And I think the resolution at WHO is a critical moment. I think we all need to support that in order to ensure we get a stronger resolution. I also want to, I think Francesco talked about the monitoring part, which is quite great. I think that's what we need in terms of enforcement and looking at where violations are happening. But it would also be great to see how, this monitoring can actually be, expanded in a way that would catalyze or use the power of citizens. And I think that's where we see, change can happen when citizens are engaged. And, the Netcode is a great initiative, but I think, more can be done. And I wonder how, what the plan with the group in terms of including perhaps maybe more citizens, youth, and civil society, and, a number of stakeholders who have a stake on this issue, including mothers. Thank you.
I'm Alison Lineker, and I've been with IBFAN a very long time. And I honestly never thought I'd see this day, so I am totally delighted and want to thank everybody involved. And my question is more specifically about Bangladesh, because I saw that this is one of the 3 countries among the 7. I've been working more recently on food safety, on contamination of powdered infant formula by harmful bacteria such as Chronobacter sakazaki. And I've heard from Bangladesh that they are working on bylaws, they use the English word bylaws to implement the code, and that these will include sanctions and monetary penalties inflicted on companies if any baby dies from contaminated formula. So I wonder if you have any more information about that. I haven't actually read the report in full yet, but look forward to doing so. Thank you.
Richard Benatti, University of Sydney. So I'm from one of the countries with low uptake of breastfeeding. I have 2 questions. One pertains to the provision of milk sharing, human milk, breast milk sharing in emergency situations. Could the panel comment on that? Is that a route to protect in critical phases against the uptake of formula? And the other thing, it's a more Australian. There is a view that the rights, the reproductive rights, also provide choices to mothers, and lactivism is not necessarily positively viewed. So what's your view in terms of mothers having choice beyond breastfeeding? Is this just a norm against which one can't argue, or are there other ways? Again, it could be human breast milk sharing.
Great, thank you. Do you want to come with one, Anthony? And then you've got a lot of questions for the panel.
Sorry, Anthony Costello from WHO. First, to congratulate the panel, because this is hugely overdue. This is, children are our most valuable commodity. They're not a commodity, but you know what I mean. They're incredibly valuable, and what we feed them is incredibly important. And this is the first report, and the results are actually pretty depressing, I think. That we're not monitoring particularly effectively, and that actually when you look at it, the official figures are really not very good. And my question is the dark side. If you look at the financial industry, we're well aware now that most of the markets are actually riddled with corruption, with all kinds of rigging of, you know, foreign currency markets, share markets, whatever. In the pharmaceutical industry, you're seeing an awful lot. A lot of the companies are having some of the biggest corporate fines in history because their salespeople are out breaking all the legislation that they're supposed to be monitoring. So I'm interested to know, is there any information about the extent to which sales forces are ignoring the rather weak legislation, or whether there is actually backhanders being paid to governments to stop the legislation from being introduced?
Wow, what a fantastic range of questions. So I'm going to, can I go along the panel from the right and ask you to pick up your answers to any of the questions? We've heard things about the trade battles, so how are we going to manage the trade battles? We've had comments about making sure that the resolution and the code extends to all ages and how we're going to get a strong resolution through WHA. Questions about how is the monitoring going to be extended and expanded. Specific questions on Bangladesh and the contamination of formula. Then questions about milk sharing in emergencies, about lactivism, great term I was unaware of, and protecting mothers' choices and what that would look like. And then a question on the sales force, is it backhanders? Is that's what preventing implementation of the code? And just related to Anthony's question, I'm going to throw one in too, which is the point about monitoring not being so good. I did find those statistics quite shocking, that only 6 were funding monitoring processes. What are we going to do to get that monitoring funded so we get effective accountability? So, Mike, would you like to start with some of those? You don't feel you have to answer all of them, but as many as seem relevant, please.
Yeah, I'm going to start by sort of zeroing in on the monitoring. And monitoring isn't the end in itself. You monitor because you want to stop the violations. So there needs to be an enforcement mechanism as well. In the UK, we monitor, we produce our reports. These are submitted to the Committee on the Rights of the Child, which has repeatedly called on the UK to fully implement the code and the resolutions, and has said violations are commonplace in the UK. And we have many members of the public reporting violations to us, and also things that break the weak regulations that we do have, which are much narrower than the scope of the code. And the problem is they see that illegal practices are happening and these are not followed by sanctions against the companies, even when there are repeat offences. So that is one of the end goals that we're really looking for. And that's why we come up against these obstacles, because if you stop the aggressive marketing practices, you're stopping the companies building their markets, because they're competing with breastfeeding. Nestle's just entered into the UK with taking over the SMA brand. It's recruited a network of clinical representatives. Their stated job description is to go out and get brand endorsements from health workers. Because of the UNICEF Baby Friendly initiative, they can't get into hospitals, so they set up events at nearby hotels and try and get the health workers to go to those events. And they'll sometimes have speakers on totally different issues, but they'll be there promoting the products, and you have to sign up through a branded website and get on their mailing list. One of the case studies that I'd like to highlight in the report is India, which is a success story where sales have not grown as they have in other countries such as China. And their real driving force for the strong regulations was the Indian Pediatric Association. They decided themselves that they wouldn't accept funding from the formula companies, and then worked to get that into legislation and help build the political will. We're very pleased in the UK that our Royal College of Paediatrics and Child Health voted last month that they would stop taking funding from the baby food industry. And that came from the paediatricians themselves, bringing what was a contested motion to their annual general meeting, but it was passed. So there's something that health workers can do to educate themselves on the code and to implement it in their own settings. And I'd just like to finish by saying something about the lactivism point. In the Lancet study that just came out, the UK was the worst in the world for breastfeeding at 12 months of age, less than 0.5%. And there were some comments, well, we need to do more to persuade mothers to breastfeed. But that isn't the answer. We know what we need to do to enable mothers to breastfeed because it's already been set out in the Global Strategy for Infant and Young Child Feeding. And it's a whole range of issues, including implementing the code, the baby-friendly initiative, information and education, maternity rights, and so on. And what we should be thinking about is enabling mothers to breastfeed for as long as they want, rather than this idea that we're pressuring mothers. Because in the UK, the government statistics surveys have found that the majority of mothers said they wanted to breastfeed for longer. So I think if we phrase things that we want to help mothers breastfeed as long as they wanted to, that may go some way to being seen as coercion.
Yeah, thank you. I mean, it's been great, all these good questions, but I'd like to make 2 points. First of all, we have 3 magic words in the strategies and the policies that talk about breastfeeding, which is promotion, protection, and support. They have to work together. We need to promote, means, you know, we need to have social norms. And by the way, I thank the testimonial we have today, has breastfed the children in public. The Pope said to a mother, you can breastfeed in the Sistine Chapel. So that's important, social norms, number one. The protection, which is really making sure that we have a code in place, but a code which is strong and basically reaches a critical mass. I think the problem of the numbers there, we're not having a critical mass of countries who are implementing the code. That's why trade discussions become difficult, because you have few countries. We need to have a critical mass. We need to scale up the presence of legislation. And third one is support. And support means having health workers who understand the issue and are able to provide all the necessary support to mothers. And unfortunately, we do not have a successful baby-friendly hospital initiative in all the countries. We're reviewing the criteria, and this year in November we have a summit, a congress on baby-friendly hospital to try and change again the status of the art and making the compliance with baby-friendly hospital elements part of a requirement of any hospital. It's not an exceptional thing. It's a basic of a hospital. And then finally, the support to mothers who are working. I mean, if we don't have good maternity protection in place, if we don't have enough time for women to be out of their job, but then being allowed to go back to the job, then mothers will, of course, look for an alternative. And having the possibility to breastfeed on the workplace. Well, these are all elements that need to come together. I think we have an opportunity here, and the fact that we have an interest, an increasing interest in nutrition, we have successful initiatives, big movements who are now willing to see, and I'm thankful to Marilena for having mentioned the Sustainable Development Goals. I mean, we have SDGs to achieve. We are at the moment at 37% exclusive breastfeeding. I mean, it's ridiculous, 1 child in 3 for such an important intervention. And we have a goal of the World Health Assembly saying 50%. So we now have a decade of action on nutrition. I mean, one of the goals of the decade of action on nutrition will have to be to have at least 50% of the children exclusively breastfed. So we think this is just a step of awareness, certainly of our organization, to see what we need to do to scale up our work. But we're still a small group. I think we need to have a much greater group. And I agree, Ms. Svein, it's about engaging citizens, engaging youth, engaging mothers. It has really to be, again, a large movement. It was initiated, but we forgot about it.
Thank you. And I would like to get back to the professor from the Sydney University, who I'm grateful he raised up the point of breastfeeding in emergencies, because for us, speaking from UNICEF perspective, and having been in the field and having addressed the issue a few times, this is a big challenge. I mean, no matter, I mean, it is difficult enough with the legislations in all countries. We heard this today, and again, once more, couldn't stress enough the importance of this report, but in emergencies, this is a big issue. And for the reasons that, and it comes to us every time, I mean, I'm still surprised. I don't know, it's good, I think, to be surprised after all these years to work in this area, but I'm still surprised that it's raised so often. And there is sometimes a misconception that because it is an emergency, we should find solutions that they are considered maybe to be efficient. And I will come to the point I want to make is about donations in kind of breast milk substitutes. But actually, and I'm really very grateful to have this opportunity to make the point, in humanitarian crisis, in emergencies, children are even more vulnerable. So if we have just spent an hour and a half to prove the vulnerabilities of children, and when they are not breastfed, I would say in a normal circumstance, I mean, you can imagine in a situation of crisis when the risk of hygiene, of poor health, undernutrition are even higher, how difficult it will be for a child to survive. And this is really a matter of child survival and child rights, as I mentioned. So it is extremely critical in all situations, including in crisis and humanitarian situation, to protect breastfeeding in emergencies. This is a very important element of our work, and we hope with this report today, we can also contribute to this strong advocacy, and donations of breast milk substitutes should be prohibited. This is really important, and I know it is always a challenge, because there is this also goodwill of those who think they are doing the right thing. It has been brought to my attention several times, oh, but we thought that was a good thing to do, to save lives. No, it doesn't. But of course, if there is any distribution that is necessary because of specific circumstances, this should be controlled by health personnel. And we know it is also an issue in the current crisis in Europe. We discussed this last week at UNICEF, just to tell you how even current and it's here the issue. But also we know that there are interventions possible that should be done. So to provide breastfeeding assistance, private place for breastfeeding, for nutritional support to pregnant women, to breastfeeding women, even in situations of humanitarian crisis. And this is being done also in the current crisis in Europe. We even to make sure that space and that support, it's there. So I think it's an important point, and thank you for raising on the milk specific sharing. I wouldn't know, but just to put maybe this in a perspective that the support is, if not as important, it's even more important in a humanitarian crisis. Thank you.
So let me start by echoing some of the comments about the partnership and how this is indeed a historical day to come forward with a joint report. This really grew out of this Netcode partnership, which is really the brainchild of Francesco Branca, bringing us together into a partnership to work out how do we actually address the advocacy, how do we address the monitoring issues around the code jointly. For too long, we've been individual organizations having our own approaches. And he said, no, we really need to come together and do this jointly. And one of the projects of that was to say, look, we've all been reporting about how we're doing in implementation, but we all do it differently. And we said, look, we need to get past that. It hasn't always been easy. There have been challenges of different databases. Every organization has different ways of thinking about the issues, different ways of interpreting the provisions of the code. And that took a lot of discussion, lots of emails, lots of phone calls, lots of face-to-face meetings. And I particularly want to thank Marcus Stahlhofer, who has been the kind of point person pulling all this together, keeping all of the parties talking and writing up the results and analyzing it all, and really just kind of managing this whole report. So thank you definitely to Marcus for all of that. Secondly, this issue of how do we address some of these issues, particularly this issue of funding. How are we going to get countries to pay more attention to it? I certainly wish I had the answer, but I think that part of it comes from partnership as well. And one of the things that we're doing in partnership with UNICEF and many other organizations, including IBFAN, is the Breastfeeding Advocacy Initiative. This is a joint initiative of many NGOs and UN organizations really trying to advocate for the importance of breastfeeding, to change policies and get more funding in. And one of the key policy asks is to increase uptake of the code and to increase monitoring of the code. So it's right at the center of what the Breastfeeding Advocacy Initiative is pushing for. I wanted to come back to this issue of the trade barriers, because I'm not sure that everyone understood what Patty was saying in terms of what the issue is here. There have been challenges to countries that have had strong code legislation, saying that this is a barrier to trade. And so in free trade agreements, they're being challenged that what they're doing might be against international treaties. Every time that concern has been raised, it has been examined and always has come down on the side of countries can implement the code as defined by WHO, every single time. That doesn't mean there isn't a chilling effect. The idea that a country can be challenged when it's putting in place a new legislation makes people say, maybe we shouldn't put in place this legislation. And so it's an important message that we need to get out to countries that say, this is a false claim that you can't do this. It has been challenged before and it has always been shot down. The power of citizens in monitoring. Certainly in our Netcode protocol, we are hoping to capitalize upon that. I think there are ways that we might be able to do it better, and happy to learn more from World Vision's experiences in this of how to strengthen the power of citizens reporting. This has clearly been a long-standing part of IBFAN's work in doing the reporting from citizens and organizations that care, and we certainly want to build upon that. I think what we're learning in Netcode, though, is that it needs to go a step further than just getting the reporting. We also have to turn that into enforcement. And so we have to make sure that those aren't just, here's what is going wrong with the implementation of the code, but actually taking it to a level that those sanctions are actually going to be put in place and the government on board with actually doing that. What we're finding, though, is that that requires much more advocacy. It's not as simple as saying just have an organization within the government that receives these things. In fact, in one of the countries that we're piloting in, they said, you know, we already have a list of 500 violations. Your system is going to get it up to 5,000. But if we didn't act on 500, why are we going to act on 5,000? We have to address the advocacy and make this a critical issue. Thank you.
So just a few additional points. I mean, I think the issue of marketing is going to get even more complicated with internet, where you don't even have the trade barriers and country limitations, and where in that economic analysis or the analysis of the market value, we weren't able to get data on what companies are investing in marketing. We weren't able to get close to that, nor how much money they maybe are investing, Anthony, in incentives, maybe put it that way, at various levels within a country. But certainly we saw that the trend is going to an increased internet sales and internet advertising. So that was one observation from that particular bit of market research. But you know, when you put up the figure that at the moment the market is 44.8 billion, and it's going to go, that was in 2014, and it's going to be at 70 billion by 2019, it's not hard to imagine where some of those profits are going. And it then comes back to the question of lactivism, I think, an important one, because you know, you take the issue, you go into a restaurant, and this has happened to us, my wife and myself, and where my wife would start to breastfeed in a restaurant and she's asked to leave. And yet, if a child is formula fed in a restaurant, there's no question raised about it, which is absolutely bizarre. Something that is part of the human species, you're asked to leave, and something that is absolutely artificial, you're allowed to stay. And to me, that's a bizarre, perverse state of affairs. So the question around lactivism, I agree with you entirely, actually, that there's a negative association around breastfeeding. And it's unquestionably partly due to the marketing, where substitutes have been made so acceptable, so much part of everyday life, that breastfeeding is now seen as more on the extreme at the other end, which is, again, it's a strange thing. And then you got to say, well, what's the social value being placed? Because if you say, if breastfeeding in terms of the science is so clear, why is it that there's such, in times, contempt for it? Is it the value of the industry that is making countries fail or choose not to implement legislation? Is it that they simply say, well, we've always had children dying from diarrhea, so it's no big shake for us? It's a real strange thing. You take the view of breastfeeding in Brazil, where the breast milk banks, it's the postmen and the firemen who transport the milk from homes to the banks and back out again. Such is the social value of breastfeeding in Brazil. In about 6 weeks ago, I was in Washington at the beginning of this sort of launch of the Lancet papers, and I went to this most wonderful exhibition. It was just called Wonder, and it was just a series of very small exhibition, and just some very beautiful pieces. And there's a guy called John Stuart Mill, 1865, he wrote this. He said, "It's not understanding that destroys wonder, but familiarity." And I think that's actually where we are with breastfeeding, is that we are so familiar with it, as a notion, as an idea, that we don't recognize the wonder of it and just how exceptional it is. And therefore, all these other things follow.
Thank you. Well, I think we could carry on debating and discussing tonight. The good news is that we get a little bit of a break before getting to see a fantastic film, which I hope will fire us up even more with enthusiasm and excitement for this area. I'd like to talk for hours more about this, but it just is my privilege to thank you all very much for having come here tonight. It's an honour to have moderated a historic event like this, and it really has become clear during the evening how important it is to see all of this collaboration together. It's wonderful to have the two UN agencies working well together, UNICEF and WHO, and within WHO to have different departments working together is also a very important example of that partnership, and of course critically with IBFAN and with the broad network of NGOs. I want to just echo the points that were made earlier of thanking a number of people who are not here tonight. I was delighted to hear that Yongju Kane, I'm sorry if I'm saying her wrong, naming correctly, was working on this from Malaysia, where I stubbornly breastfed my twins in the first couple of years of their life up against long rows of breast milk substitutes in many shops there. So great to hear that Malaysia is pushing forward on the code, and David Clark, obviously, for all of his excellent work. Also want to acknowledge Kaya Engersveen for her work on this, and Ellen Sokol, and as Laurence already has done, Marcus Stahlhofer, I know, has played a critical role. He's not really just the photographer tonight. He's pulled a lot of this together. And we really want to thank Diana Esteves, who's played an important role in organising tonight's events. I don't think there's popcorn out there, but I think there's an opportunity for us to take a little refreshment before we come back in the room, but most importantly to talk with each other about how we're going to make this a reality, because I think this should be the tipping point that helps us all to work even better together and to make sure that we can turn this dream of controlling the situation into a reality through our combined efforts. So thank you all very much, and thank you to the panellists for their excellent presentations.